Hi, and welcome. We're going to talk about something that's deeply personal and often really hard to talk about: the emotional pain that can come after a miscarriage or a difficult birth. If that's part of your story, I just want you to know that this is a safe space. We're going to walk through this together with a lot of care.
Let's just start right here, because this is probably the most important thing you'll hear today. Your grief deserves care and validation. What that means is your pain, your story, all of it is real and it deserves to be seen and honored. No questions asked, and with no expiration date.
It's such a common feeling, isn't it? That deep sense of being isolated, like you're the only one trying to find your way through this. Well, you're really not.
So let's talk about that experience. The whole point here is to just kind of hold up a mirror to what you might be going through to help you recognize it and maybe even give it a name.
Do any of these hit home? Maybe you're feeling totally overwhelmed by a loss, and it doesn't matter if it was last week or years ago. Or maybe you're feeling shaken up by a birth that was nothing like you expected, one that left you feeling scared or like you had no control. For some, it's this feeling of being stuck in fear or anxiety or guilt. You might be haunted by memories that just pop up out of nowhere. Or maybe you just feel numb or angry, and you find yourself pulling away from the people you love most.
If you found yourself nodding along to any of that, I really want you to hear this. These feelings are so common. You are not isolated in this, and just as important, please know that healing from this is absolutely possible.
Okay, so a huge piece of the puzzle here is really understanding the emotional impact of what you've been through. It's so easy to dismiss our own feelings, or to wonder, is this normal? Well, let's get clear on that, because your experience is 100% valid.
This is such a simple idea, but it is so powerful. When we talk about birth trauma, it's not some medical checklist. The most important thing to know is this: if it felt traumatic to you, then it was. Full stop. It matters. Your experience is what defines it.
You know, it can also be really helpful to see the difference between grief and trauma, because they can get tangled up together. Grief often looks like that deep, ongoing sadness or anger. Trauma, though, brings its own set of symptoms, like those intrusive memories. See, when something is just too overwhelming, the brain doesn't know how to file it away properly. It's kind of like a messy desk where that one file just keeps falling out. So your brain keeps replaying it, trying to figure it out. That's also why you might feel constantly on edge or find yourself really avoiding anything that reminds you of what happened. Just being able to name what you're feeling is a huge first step.
This is a big one. It's a question that so many people carry around, often in silence. There can be this pressure, from ourselves or from others, that we should be over it by now. So, is it normal to still feel all of this, long after it happened?
The answer is absolutely 100% yes. There is no timeline for healing. Emotional pain doesn't work on a schedule. It can pop up again when you least expect it. And I want to be really clear: it is never, ever too late to ask for help.
So, acknowledging the pain is a huge first step. Now, where do we go from here? Let's talk about the path forward. Healing isn't some magic destination you just arrive at. It's more like a guided journey, something you take one step at a time.
So what does that journey actually look like? Well, a really supportive, trauma-sensitive approach usually has a few key parts. First, therapy to work through that deep emotional pain in a safe space. Second, learning practical tools like mindfulness to help you manage triggers when they happen. Third is something called psychoeducation, which is just a fancy way of saying you learn why your mind and body are reacting the way they are. Knowledge is power here. And finally, making sure there's support for your partner and family, because they're part of this story too.
And to get even more specific, what does that support actually feel like? Well, it can involve proven therapies like EMDR, which helps your brain reprocess difficult memories so they don't have the same emotional charge. Or something like CBT, which helps you notice and shift thought patterns that are keeping you stuck. It also means learning really practical things like grounding techniques for when anxiety spikes. And all of this is done in a way that truly respects your background, your culture, and your beliefs.
This is such an important question, because loss and trauma, they don't just happen to one person in a bubble. They send out ripples that affect the whole family, especially a partner who went through their own version of the experience.
And the answer is a big yes, absolutely. Partners are so welcome and are often encouraged to be part of the healing. You know, grief can be tricky for couples because we often process it in completely different ways, on totally different timelines. Bringing you both together in sessions can help you understand each other's experiences and really strengthen your connection when you need it most.
Okay, we've talked about the pain and we've mapped out a path forward. Now we're at what might be the hardest part,
but it's also the most powerful one. Taking that first step. This is all about realizing that asking for help isn't a sign of weakness, it's an incredible act of strength.
And maybe this is what you're wondering right now. How do I really know? How do I know when it's time to go from just trying to manage on my own to actually reaching out for professional support?
Well, here's a pretty simple way to think about it. If you feel stuck, if that feeling of being totally alone is just too much, or if you just feel like you can't move forward emotionally, that's a sign. Therapy is designed for exactly that. It's meant to give you the specific tools and the safe space you need to actually heal.
Which really brings us right back to where we started. No matter what your story is, no matter how heavy this pain feels right now, you do not have to carry it by yourself. Help is out there. So I want to leave you with this final thought to just kind of sit with. Healing isn't about pretending it didn't happen, and it's not about forgetting. Healing is personal. It's about finding a sense of peace, maybe rebuilding hope, and weaving this experience into the fabric of your life in a way that lets you move forward. So what might that look like for you?